I'm currently in a bus 23. We going back, driver? Okay, thank you. My name is Dr. Thandeka Mazibuko. We're tracing the path of the cancer patients in Boston. What do they go through? What bus do they take? How long is the bus? Because before you can claim to know the patient's life, you gotta walk in their path and understand the challenges that they're facing with transportation, housing, community, because that determines their health care. I'm currently in a bus. I've been treated so kindly. All my questions were answered. I'm learning so much. We cannot wait for funding to do the simple work as getting in the bus. It cost you $1.70, and the driver told me that this bus is free for Route 23 because the community in Route 23 may be the community that's previously disadvantaged, and the aim is to make sure that they get to their destination so they don't have to pay a fee. Since COVID, before COVID-19, before 2020, they used to pay, but from 2020, nobody pays a fee, which is quite something, because then it means the patients who come or go to healthcare centers don't have to worry about the cost of healthcare or accessing healthcare. Paradigm shift in the management of cancer is key. We spoke intensively about how it's important for us to meet the patients halfway and be at the patient's places and understand the patient's journey to be able to impact the patient's life. My name is Dr. Thandeka Mazibuko, and I'm tuning in with you today from bus route 23. I must say that this bus route is long. It's really long. You can imagine for someone who's sick, they have to connect to bus number 8 to get to the nearest hospital. So you cannot just sit in one bus. They have to take 2 transports. And this is the United States, a state that should provide for all people without discrimination, without bias, with inclusion and diversity. And we need more doctors of color. We need more doctors who are trained in oncology, who understands, who lives in our community. I wonder if there's any oncologist in this community when there's not even a hospital. And what I also notice is that in Dorchester, there's a clinic. Oh, nice. But it's a small clinic, not a hospital, right? It's a health center. Okay, thank you for sharing. So there is a health center on this route, but there is no hospital, and the driver says it's a big clinic, very effective clinic, and I'm sure there's no oncologist in that clinic because the oncologist needs a tertiary center in order to be able to treat cancer. So it means the cancer patients might be traveling a long distance with the pain, going through chemotherapy, going through radiation, going through symptoms, going through side effects, and even just when they feel the lump. It's gonna take longer for them to get health care because traveling distance has an impact on compliance. I'm gonna end the conversation right here and enjoy the trip before I bore everybody with all the details, but thank you for tuning in.